So a really good example of direct contracting is something called direct primary care, or DPC. Something called DPC is when members are going in to see their primary care doctor, normally without any copay. And they get to go as many times as they want, and typically they're able to visit longer with their doctor. What the data shows with this is that having that access and that relationship with their doctor is reducing the amount of times that specialty referrals are needed, and also the amount of times that emergency room visits are used, because that member knows better about what's going on. They're happier, and they're actually going to then, for the employer, they're going to see more engagement, and the retention is going to be better ultimately overall as well. We've seen as much with this relationship of reducing overall costs to the employer by 30%. But not all versions of direct primary care are exactly the same. There's on-site, there's near-site, there's concierge, there's a whole bunch of different types. So what's the right fit? And that's when you really want to check out our white paper to be able to get some more information about how direct primary care is good for an employer that is self-funded. Something self-funded employers are doing now that's very different than in the past is not contracted actually with providers and seeing an impact from that in a very good way. The most recent example is from reference-based pricing, or what's also called RBP. This is when the employer doesn't have that contract, as I mentioned, but they're paying Medicare, but a percentage above that when a member goes in to see their doctor. This is really trying to basically reset the amount of money that Medicare is paying doctors versus what the PPO plans are paying doctors, and narrow that delta together. Basically, employers are asking the question, why are they having to pay more for the same service? It's the same member, or maybe multiple members that are doing the exact same thing. Why should they pay more, and significantly more? If you didn't know, PPO contracts, generally speaking, are anywhere between 3 to 7 times what the cost of Medicare for that same exact service is. Employers are not wanting to see that delta anymore, so they're making changes with RBP. Our clients that are using RBP, though, are seeing immediate savings from this. Somewhere in the range of about 30% of their claims if you compare them year to year. And many of those employers are reinvesting large portions of that savings back into their members, in either in the form of lowering their out-of-pocket costs or their premium contributions, which is a great story to be able to tell to your current folks and then anybody else that's coming in.